So as Debs has already introduced, we are here this evening to cover the third in the series of the RCVS Workforce Action Plan, Ambition Explored sessions. And today's session will be covering Ambition 3, Greater Responsibility for Veterinary Nurses. As already introduced, my name is Shirley Gibbons. I'm the Qualifications Manager in the Veterinary Nursing Department at the RCVS. I am a registered veterinary nurse myself, and I oversee all of the veterinary training provision within the UK. So all of the licence to practice qualifications and all of the certificate and advanced veterinary nursing qualifications as well. We have a very small team, but we are small but mighty, I would say, in the vet nursing department. We cover a huge amount, and this particular area of the action plan is really matters to us because in our small team of 8, 6 of us are veterinary nurses. So progressing the profession, supporting the workforce, we're not doing that because we work for the RCVS. We're doing it as well because it matters to who we are as registered professionals in our own right, and supporting and empowering registered veterinary nurses to take on the roles and responsibilities that they're able and eligible to do so. So this evening, as I said, we're covering the greater responsibility for veterinary nurses, which includes demonstrating the capabilities of the veterinary nursing role, continued RCVS support, as I mentioned, this really matters to us, for veterinary nurses through the VN Futures project, ensuring there are clear career pathways for veterinary nursing, encouraging veterinary nurses to utilise their full skill set, and continuing to make progress in changing veterinary legislation. I'm fairly confident more of that is going to come up later. I'm joined this evening by a panel of stakeholders from the profession to share their thoughts and experiences on this particular topic. We do have other workforce webinars that are ongoing that are covering the other actions. So if that's also of interest to you, please do register for those sessions and you can come back to those particular discussions at that point. But for the purpose of this evening's discussion, we will be exclusively focusing on the greater responsibility for veterinary nursing. So I have on the panel with me Charlotte Pace, registered veterinary nurse, who is the current BVNA president, Belinda Andrew-Jones, RVN, who sits on RCVS BN Council, Matthew Rendell, who also sits on RCVS BN Council and is in fact the chairperson of BN Council. And I'll just take a moment to ask the panel to introduce themselves quickly and share their specific backgrounds, so that you can know and understand why this particular issue matters so much to them. So Charlotte, if I can start off with you, please.
Hi everybody, my name's Charlotte Pace, as been introduced, and I'm the current BVNA president. I've been nursing since the year 2000, and I have spent time in referral, in first opinion, and also teaching of degree and diploma. And as BVNA president, I'm sure most of the audience are aware, we've been championing the Protect the Title. So that's my interest.
Thank you, Charlotte. And Belinda, please.
Hi, good evening, everybody. So I'm Belinda Andrews-Jones. I'm a veterinary nurse. I've been in the veterinary profession for about 32 years. I started very early. I've done a variety of working in most type of veterinary practices, so from small animal to large animal, mixed practice, equine. I spent 16 years at the Royal Veterinary College as a senior emergency and critical care nurse, but also from education point as well. I was director of nursing for CVS for 3.5 years, and through COVID I ran a COVID vaccination service for the NHS, so utilising different skills, and so now I'm a veterinary business consultant for Vet Dynamics, and I've got lots of different qualifications in veterinary nursing, but also chartered manager and education as well. Thank you.
Lovely, thank you, Belinda. And Matthew, please.
Yes, I'm Matthew. I'm a veterinary nurse. I'm chair of VN Council. I still work in practice and I still have students, higher education and further education. I work for a wildlife charity as well. And I've spent the last 6 years on VN Council just to kind of do our bit to do what we can to maximise the opportunities for veterinary nurses in our amazing profession.
Lovely, thank you, Matt. So we're also joined this evening by Rick Harris, who is the founder of Customer Faithful, which is a research consultancy who some of you may have met during the series of insight sessions ahead of the Workforce Summit back in 2021. Just before we dive into the discussion piece, and then I will hand over to Rick briefly, I just wanted to reiterate Deb's message from the beginning of the webinar. The chat function is available to you. Those messages will come directly to the panel. So please do share your comments, your questions, and we can then consider those and hopefully cover everything that you have to ask of the panel during this evening's session. So I'm going to hand over to Rick now, who's going to talk through how the voice of the professions fed into the Workforce Summit and the subsequent action plan. Thank you, Rick.
Thanks, Shelley, and good evening, everybody. I'll try and share. I've got a couple of slides. I promise it is only a couple because it's not that kind of evening.
There you go, Rick.
Perfect. I can see it. I'm looking at two screens. Great. Yeah, so I wanted to just spend a couple of minutes just talking about where this, the insight came from that drove the Workforce Summit, which is back in very end of November 2021 now, so a little while ago. So I put together this just diagram to show how it was built. We sent out a whole bunch of invitations for people to join focus groups across the UK, run by ourselves. So important that it was independently run so that people could kind of say what they really felt. We got an enormous response. We could have run 100 people in the sessions. But we ran about 46 people of all different types, including a dedicated nurse group, which I think is particularly relevant for tonight, and I'll come on to that in a second. The second stage, having run those groups, just move the slide forward one, was to feed that insight, and there were hundreds of insights. We built a whole database of them, of what people valued and thought was important, and shared that with the Workforce Summit. For those, some of you may have attended, quite a wide variety of stakeholders from government to education. And we had a kind of design thinking approach to that event, which is important because it frames it in a positive light. So that phrase there you see on the screen, how might we change this? How might we change that? Because I'll be honest, a lot of the feedback we got was people expressing the challenges of being in the workforce, and certainly the nurses were very upfront, not backward in coming forward, as they say. So I wanted to make sure that we did frame that in terms of a positive, constructive way of looking at ideas and sharing it across the group, and that we certainly did. And then the third aspect of that was to take the outputs from that session and bring it back into the college, and indeed engage with other stakeholders to build an action plan that spoke to some of the ideas that were generated on the day, and to integrate the many initiatives that were already going on actually in the college with some of the ideas that came out of it. And that's really where the ambitions came from. The next slide just shows you the 6 themes that went into that summit. So these are basically the 6 themes that we heard from focus groups, and indeed we did a whole bunch of one-to-one interviews as well. I'm not going to run through these all on the screen, but you'll see quite quickly that those 6 morphed into the 7 ambitions through the work of the college over the last few months. So the next slide kind of shows on one side the themes that went into the summit that came out of the focus groups, and on the right hand side you can see the 7 themes. They kind of map together. That additional one is the top one, which is shape leaders at all levels, which really runs across all the themes. And tonight we're on ambition 3, the greater responsibility for veterinary nurses. And I think the thing that really stands out for me about the ambitions is how they have taken what were quite standalone themes, quite individual issues, and have blended them together. So the whole set of 7 ambitions kind of hang together, as I've said there, in a cohesive program. And I think that's really key to make them work as a set and to integrate with the many things that the college and other stakeholders were doing at the same time. So that's the sort of generality about where did this insight come from and the process of ensuring that the voice of the profession was heard. I want to just share one final slide to kind of inspire you, hopefully, or at least certainly to get the creative juices flowing in the discussion of some of the things that were said against the theme of career development in the 6 themes, but specifically about vet nurse job progression. And I've filled this slide with quotes. I could have filled 20 more, but on, you know, just to give you a bit of a feel for it, I think it's interesting. Some of the slides you see down on the left-hand side, won't run through them all, but you can read them yourself. I feel well supported when I started in first opinion practice, quickly recognized the ceiling where I worked. If I wanted to progress, I had to move into vet hospital to learn from people around me. And you can see some of the other quotes there. We heard that theme a lot, people feeling that such is the way the industry have gone, particularly in terms of general practice, perhaps pushing out some skills to specialists, and therefore that doesn't happen so much in general practice, and nurses feeling they didn't get to exercise some of the things that they felt they were trained in. And then beyond that, I haven't specifically put a quote here, but it won't surprise you to know that many of the nurses felt that they could do more than they were currently be allowed to do under Schedule 3. And I'm sure you'll get into that tonight. And you can see some of the extra themes I've put there around certification, feeling that they perhaps didn't get the recognition for the skills that they had. They certainly didn't feel that they were being paid for the skills and the effort that they put into the role. And you can see other comments there around some of the structure around the Vet Surgeons Act and so on. So there's a lot of detail coming out of those many sessions and the quotes that we have, all tucked away in a database, and they're still available, by the way. Sophie Rogers has those, so if you need to get access to them, they're still there. But I just thought, actually hearing the voices that I heard from all those vet nurses, I thought it'd be good to have at least one slide so that you could sort of hear them too. And I hope that inspires you to get into some of the topics tonight. So on that basis, I will hand you back.
Thank you, Rick. That was firstly really interesting and hopefully reassuring for those joining us this evening, but all members of the profession to know and understand that the actions and the ambitions really came from the professions and from the workforce. You know, this is not just areas that the RCVS has kind of plucked out of thin air and decided it wants to work on. This is genuinely stakeholder-led, focused areas of work that can hopefully, as Rick alluded to, generate a how can we mindset so that something can be done with it and taken forward, and then hopefully improve the situation that we currently find ourselves in. So we're going to now move on to the general panel discussion. So I will invite the 3 panelists to share their thoughts and feelings and experiences on where we currently are, and potentially how we could start to focus that how can we mindset and shape some of those improvements for the future. So I'm firstly going to hand over to Charlotte, please.
Thank you. So I think what this does is provoke a lot of discussion and thoughts. I think it really is. I think it really is important, and I think it comes down to the crux of what a lot of nurses think and feel wherever they're working and whatever they're doing. I liked the quotes there that were on that last slide, because I think, you know, it is touching on the things that nurses think and feel. So, you know, things like pay is a big thing, thinking about, you know, accreditation and status and where can your career go. And, you know, I did like the comment there about stepping stone as well, you know, because I think, you know, if we do stay in one place for some time, then I think, yeah, we can do, as you watch people and quite often, you know, sort of those around us that do go on. Now, I guess, you know, in parts we could look at that in 2 ways. One, I would say that we could look at that almost as, you know, that's a positive, that we are helping to develop, you know, other vet nurses in the world, other vets in the world, you know, that we are a part of that process, because we do need those nurses to help that. I think with pay, is a real thing. You know, I have a few letters after my name as well, and, you know, do we get paid appropriately for the qualifications that we have? You know, I think that is a very thorny issue, and I think that's a discussion that the veterinary nursing and the veterinary profession needs to have, because, you know, just by saying that we demand more money and recognition, unfortunately, that has a toll on the vet profession as a whole. And so, you know, I think we need to have a sensible discussion about this, and, you know, what would recognise a veterinary nurse, you know, and, you know, some of it is money. It always will be money. But there are other things as well that we can do and that we can change. So, you know, for the...
On that note of pay and money,
yeah.
Who do you think should be involved in those conversations? And I mean, from, you know, a higher sense level, we want the veterinary nursing voice and stakeholders to be putting their case forward, but where should that direction go? Where should it come from, rather?
I think probably from organisations, associations like BVNA, maybe BVA as well, as the representative bodies for vets and for nurses. I would also say potentially, you know, I mean, I'm not an RCVS person, so I don't know how the RCVS works, but, you know, the RCVS as maybe as a facilitator of all that to have a conversation. I'm not sure, but we do certainly need some independent vet practices involved to get the independence, and obviously the corporates, they're a massive part of the veterinary market. So, yeah, you know, I mean, we do look, and we are looking to build a vet-led team. So I think it needs to have the stakeholders, the important stakeholders there to have that conversation.
A team led by vets.
Thank you. I think that was Sarah that just added that comment. If we could try and restrict comments to the chat function, and then we will direct them to the panel as appropriate. Charlotte, thank you for your response to my question. I think I interrupted your flow of speaking rather, so I apologise for that, but I do think it's important that we have an opportunity to really try and unpick this and make sure, you know, to hark back again to what Rick was saying, come up with some real you know, how can we attitudes, so that, you know, we know there are issues, and we know that there are things that we want to discuss and put out there and seek opinion and guidance and that sort of thing. But we also do need to try and ensure that we have an idea of what that needs or could look like. So I think your response there is completely valid and appropriate. And I'm definitely scribbling everything as you are talking. So please feel free to continue with, again, more thoughts regarding kind of where we are and what progression and utilisation of vet nurses might look like in your dream world.
Yeah, no, and please do feel free to challenge me. And, you know, if anybody wants to contact me outside of this, then there is the president email address that they can use. I'll put it in the chat when I finish talking, that, you know, if people do have specific things that they do want to raise, because, yeah, I absolutely agree with you, Shirley, that, you know, we don't want to make this a talking shop. So absolutely, if there's anything that I can do to help facilitate that and move that forward, then let's do it. So, I mean, what do vet nurses need? What can we do? I mean, I think the BVNA are doing things. So, like, for example, the Protect the Title, and that was a nice collaborative effort with the RCVS, with the whole of industry, with BVA as well, getting involved in helping us do that. And, you know, when we're talking about, and what came up in some of the questions was things like legislative change. And, you know, I think that that's a part where, you know, that we can be involved in that discussion. Part of that has to be that the title, that the veterinary nurse title becomes protected, that it's just part of the way that it is. And then, you know, again, if we're looking at things like Schedule 3, things that can change, things that we can be a part of, then we are unfortunately waiting for legislative change. You know, and again, there was a comment on that last slide about the Veterinary Surgeons Act. You know, I mean, it's so out of date, the Veterinary Surgeons Act. And again, if we can all work towards that, BVNA certainly are, and nurses can do that. You know, I've written to my own MP about it, to try and move forward for legislative change. Now, you know, the government does have other things to worry about, but there are, you know, it's so out of date. There are so many things that need to be brought into that. And protecting the title, you know, whether or not that's part of it or not is another matter. But, you know, it has to be reformed for animal welfare, for the people, and recognition of the jobs that we do, because it's not just veterinary nurses, there are other paraprofessionals as well that are affected by it. So, you know, once we can move forward on that, and also whilst we're doing it, we can put the pressure on so that we can enhance the role of veterinary nurses. So things like SQPs, things like, you know, being able to do boosters, because at the moment we're hamstrung by that very outdated Veterinary Surgeons Act. So yeah, I think there is a lot of potential as to where we can go with the profession. You know, and I see myself as one of those people that has pushed forward, you know, that some people on this call will know, you know, I've had my own struggles through life, but, you know, I want to make a change. I want to do things. And, you know, there are times in life where, you know, you do get to a point sometimes where you can stop and you can give up, or you can carry on and you can be part of the solution. And, you know, and it is, you see, sometimes I think, you know, people might think, well, it's okay because you're the BVNA president. That's not something I've kind of gone in for. I'm a veterinary nurse. I work in practice. I am a clinical coach to a student. I see the pressures. I live that work, daily work. You know, I know exactly what it involves. And I think that sometimes if we can just encourage each other, you know, because that is what helps us. That's what gets us through from day to day. Just even if it's just one person championing in the corner, you know, that does believe in you, that you want to. So, you know, that can help you move forward in your career, and whatever that might be. You know, like I say, I didn't have any aspirations to become BVNA president, but you know, I did want to always be the best nurse that I could be. So that meant doing the VTS in cardiology. That was a way for me to prove myself. But that came out of adversity. So, you know, I guess it's also having some kind of belief in ourselves as well that we can do it. But we need that. We need the support from others around us. You know, there's only a few people who can really do it on their own and drive themselves. You know, we need the support of everybody around us. But, you know, veterinary nursing matters. That's why all of us are here tonight, because veterinary nursing matters. And to take this to the next step, you know, we're looking at the BVNA at retention and recruitment. You know, we need to keep nurses, no matter whether, you know, you've freshly qualified from school or from uni, or, you know, all the way up to my age, and keeping the experience that I've got in the profession, you know, and I'm not saying me personally, but, you know, people of my age, because we've all got something to add. So I can't lift dogs like I used to be able to, but I can help my student, guide her and teach her how to do these things.
Yeah, I think, again, Charlotte, I think all excellent points. I sincerely doubt there's anyone on this call that would be standing against you with the proposed changes to the Veterinary Surgeons Act. I think that's something that, you know, realistically everybody in both professions knows and recognises is due for an update, to put it politely. I think legislative change is something that has been discussed and lobbied for, you know, from various veterinary organisations and the RCVS. And that's been ongoing for a number of years now. And as you alluded to, the government has been a touch busy with a few other bits and pieces. But I really liked your comment of being part of the solution, and actually the comments you went on to make about empowerment and being part of the team. That I think is a really valuable point that in general I think is something that we do routinely see in the veterinary nursing profession, and that honestly I think is how we do manage to survive through adversity. So I think, yeah, again, I've been madly scribbling down all of your comments, and I'm greatly appreciative. I'm going to move on to Belinda now. Thank you, Charlotte. I suspect we'll be coming back to you. And just to reiterate, everybody that's on the webinar this evening, if you do have any questions for the panel, please do pop them in the chat box, and we will pass them on and hopefully get a chance to discuss them later. But Belinda, if I can hand over to you now, and same thing really, you know, in terms of what you see the problems as being, how you think that could be addressed, or potential solutions, or, you know, how do you think that the role of the veterinary nurse can be elevated? What opportunities are there?
Yeah, I think there is so many opportunities with veterinary nursing. I think when you first start in the profession, you think it's, you know, working in a small animal practice with cats and dogs and those kind of things, but actually there's so much scope to, you know, there's so many transferable skills within the veterinary nursing role, and it can be used in a multitude of ways. And I do believe, you know, agree with a lot of what Charlotte's saying of, there's a lot of times in certainly my career where it's the stepping stones, and it's moving your career and moving your to whatever makes you happy in your role and whatever suits your life, and also from a kind of work-life balance, what suit you. You know, when, you know, I started when I was 15 years old, I'm a very different person to where I am now, but I'm still in the veterinary nurse profession. But along the way, I've kind of molded, you know, I've had a daughter, you know, I've been working full time the whole way through, and there's just so many different ways that you don't, if you know, to evaluate your role and see where you want to go and move where you need to. And there's just, the scope is just getting bigger and bigger for the role of the veterinary nurse, of what you want to do within that. And certainly for me, I've evaluated, you know, in parts of my life and my career, I've evaluated at times and think, why am I doing this? What brings me back? And there's been a few times where I've had to do that, of think, okay, so you know, why did I start off being a veterinary nurse? And it's because I love working with animals and I love helping animals. And actually, sometimes we're doing a different role, you can help them in a different way. So for instance, when I was teaching, if you teach a lot of vet nurses how to do a really good job, actually you can help more animals. So it's a kind of different way of thinking about it. And certainly for me, I think stepping stones is a good way of thinking about it, of developing your career. And I always think, push yourself forward and do push for the next thing of what you want to do. And like Charlotte, very similar to it, I've always wanted to do be the best and do the best in whatever role I'm doing. And you know, quite a lot of time that affects, you know, me doing things like education and learning in different ways. And I would always try and encourage people to learn in whatever role that you want to do, whether it's doing more surgical skills and learning that from other people and ask people to help you, and you know, getting advice and learning and doing courses, is to try and develop yourself is really, really important. And yeah, whatever it is in your role, do whatever makes you happy, and develop it further. Regarding what you can do to change the profession or to help it going forward, I think one of the biggest things you can do, like what Charlotte said, is campaign. Is when things like surveys come out from people like VVNA on RCVS, please do them, because they make such a difference to the amount of people that and the information that we get to actually put things forward. And do things like and contact your MP. I had a meeting in Westminster with my local MP to discuss it, and actually that can make a big difference. We're such a small little profession, and for the government it's you know, we're tiny, but actually it makes a big difference to our profession if we can get things like law change to actually make a difference. It will take a long time, it's not a quick fix, but the sooner we can crack on and the more support we get, the bigger it will be. Yeah, what else, Shirley, was it? You didn't know. I probably waffled
just to pick up on a couple of those comments, Belinda. Firstly, your call out for people to respond to surveys, cannot reiterate that strongly enough. Survey responses are historically not as good as they perhaps could be, particularly with regard to RCVS surveys, although I think it is fair to say that the response to the most recent VVNA Protect the Title survey was you know, it was phenomenal. It's things like that we need. We are always talking about being an evidence-based profession, and actually we need evidence to be able to back up our lobbying to government. And you know, as Belinda was saying, going to the MPs and saying, this is what we want and this is why we need it. We need to be able to say, this is the opinion, this is the statistical response that we've had. And without survey responses, that's just impossible. So those are excellent points. And you've both touched now on the consideration of stepping stones in terms of your career and profession. And I think it's a really good point. But I do worry that there is, it's easy to say and perhaps less easy to do. So what would your advice be to someone who was thinking, I'm ready for my next stepping stone, but they don't really know where to go or how to get there?
I would say find out as much information as you can, whether it's whatever subject you want to do. Go and seek work experience somewhere else. Just because you're working in one practice, say you want to do referral, go and speak to the local referral centre. So go and see if you can spend a day there in a subject that you like. And they, you know, majority of the time, you know, I've done this in my career multiple times, and I've usually been very much welcomed. So even, for instance, I wanted to find out, we're going to do renal dialysis is where I was working, and there was nowhere I could find renal dialysis training. So I actually found a human hospital that would take me, so I could learn from the human side, actually, which I could bring back to the veterinary side. So whatever it is, try and seek experience in it, and try before you buy. It could be that you want to do ECC, so you do a few shifts for Vets Now and see if you like it.
Yeah.
And just try new things.
There's a comment in the chat function, Belinda, that I think you might be best placed to answer, based on your hugely varied experience in both our world and the human world, and that's with regard to the term of the vet-led team, which Charlotte referenced in her brief introduction. The question is, how do we feel about that in terms of terminology, and does it actually help us as a group of professionals be as visible as we perhaps can be, or is it perhaps the wrong terminology?
That's quite a difficult one to answer. It is, as it stands, with the law as it stands, we the vet-led team kind of works with how it stands at the moment, but it might not necessarily with the law changing of, you know, in the future. And as I said, could be 10 years till we change the future, it could be longer. That then things might have changed, and it may well be that it will be a vet team approach. But as it stands, it's probably the most suitable at the moment to be vet-led. Matt, what do you agree? What do you say? Sorry to put you on the spot.
Sorry, just trying to find the unmute button. I think I've never been a massive fan of the vet-led team. I think we work synergistically together, and our output together as a team is better. Certainly, when you get more experienced, and Lou has touched on this in the chat boxes, you know, you do have a skill set that enables you to enhance and kind of really bring your experiences to that clinical kind of picture. So I don't think it's necessarily, you know, the perhaps the most accurate term that we use, but we do work under the umbrella of the vets, and the vets are basically there, and they're delegating things to us under Schedule 3. And I think that's something we'll come on to, obviously, is Schedule 3 and how we talk about it. But I don't think we need to get bogged down on these kind of terms. I think it's more about just looking at the bigger picture of the clinical team. I think we are a clinical team, and everybody brings different strengths and weaknesses to that team. And any of those, you know, as long as people have a voice within that clinical team, all good.
I guess my question, and the reason I posed this to Belinda quite specifically, is that my assumption, and forgive me if I'm wrong, Belinda, is that in your NHS settings, you were never in a doctor-led team.
No, and so in hospitals, they have two different types of hospital. They have an acute trust or community trust. I was working for a community trust, which I would probably say 90% of it was nurse-led. So my whole department, there wasn't a doctor involved in me setting up the whole department. And we employed hundreds of people, and some of which I employed doctors, but they were all at the same level, so they were employed as similar to nurses. And so it's I probably have a different perspective to most people in the veterinary world. Of I see a future where if a human nurse can do it, why can't we? And that we should be. It should be kind of equal across, but you know that's going to take quite a long time to be able to. You know, we're so much behind the human side, so. But yeah, I see why. You know, why can't it be much more nurse-led for the future? But we kind of have to take it in stages.
Yeah, I think that's excellent points in terms of why can't we better reflect our human counterparts, but also. We do have to recognise the way the legislation currently stands, and whilst there is absolutely an aim for that legislation to be reviewed and updated, we need to always bear in mind that Rome wasn't built in a day, and if we're going to get it right, it needs to have the time and careful consideration that that is going to require. So thank you, Belinda. I'm going to move on now to Matt and his consideration of where we currently are. We've got a lot of really active chat going on, which is brilliant. So once Matt has done his brief introduction and consideration about some of the particular areas that I'm going to pose to you, Matt, you'll be pleased to know, we'll come back to some of those questions, and I think we can have some really active debate and discussion about some of these questions. So Matt, my question to you, and again, this is very much based on your incredibly varied career that you've had, how do you believe veterinary nurses can be supported to develop a wider range of skills? And when I say wider range, I don't necessarily mean purely in the clinical setting. I mean in a variety of clinical settings, or even outside of the clinical setting. And from your own personal experience, how do you think a veterinary nurse can manage all of the different kind of options that are truly available to us?
Okay, thanks. I picked up on the brief. Don't worry, I won't go on for hours. I think the key thing, and it's kind of been touched on a little bit already, is I don't think nurses are actually doing everything they can actually do under Schedule 3 already. And I think that's kind of something that we really do need to work on. The confusion and just a general lack of clarity around Schedule 3, and vets not really particularly knowing what they can delegate, nurses not knowing what they're allowed to be delegated. That to me is an area that we can all get on and do stuff with now. One thing that I've learned over my strange career is that actually communication is everything. So if you can actually sit down, have a conversation with someone, explain what actually you are or are not allowed to do as a veterinary nurse, and also discuss your skill set. And again, this has come up in the chat box, maybe that you are somebody that has a huge amount of experience in a specific area, or you may be somebody that actually would like to get more experience in a specific area. I think we can really maximize what we do, what we're able to produce and do as a clinical team, if we just have that conversation. And I think that conversation just needs to be, absolutely just complete clarity. I'm good at this. I'm not good at this. I would like to be good at this. I'm interested in this. We have lots of practices now work with amazing veterinary surgeons that probably have a wealth of knowledge that they could actually empower their nurses and kind of support them to develop their skills in a specific area. But there is a time restraint in that, but it is about investing the time. That time is well worth it, and we'll come back to you in many kind of magnifications. So I think that's the first thing. I think it's about, yes, we will have reform of the Veterinary Surgeons Act. Yes, that will come, and there will be great benefits to the veterinary nursing profession. And with that opportunity comes great kind of responsibility as well. So we just need to make sure that as a profession, we're receptive and ready to respond to that, those opportunities that arise. I think one thing we can do as well, which we can do now, so this is not about kind of blue sky and chatting. We can just empower each other to have awkward conversations about salaries and things. The Royal College doesn't get involved in salaries. It's not within our remit, but it's something that I would encourage personally, just to have those conversations. They're never as bad as you think. And I think it's an opportunity to really kind of, discuss those things and be absolutely honest. We're all under a lot of pressure financially at the moment. I would say it was interesting seeing the slides that Rick put up at the beginning, and how much actually some of that stuff is already happening. So I think some of it due to problems around recruitment, that now I feel that salaries are going up, and I feel that there's lots of stuff going in, and I think that that some of this stuff is happening. But I think for me, I think it's about having conversations, professional conversations, making sure that you're exploring every option that you can within Schedule 3. So gathering diagnostic information, gathering those clinical information, just providing that support network for the veterinary surgeons as well. So I think we just have to be a little bit careful that we don't kind of hang everything on one thing. I think there's lots of stuff that we can be doing until we get the legislative reform stuff going. I think it will happen, but I think there's lots of things we can do now. And I think clarity around Schedule 3 and how we delegate stuff and what we can do in the field of gathering clinical information, I think is really, really good. But nurses are not good at those conversations. And I think that's something we need to, as a profession, we need to reflect on and do, basically, get on with it. So.
Yeah, you are totally right, of course. And as we've said, legislation is not going to write itself overnight. And so one of the things, again, to go back to the very beginning of this webinar, it is about what are we going to do now so that we can support, empower, develop the veterinary nurses that are registered and training right now. You have talked about Schedule 3 and the lack of understanding as to what is actually allowed, and a few people have mentioned that in the chat as well. And there's also been a consideration in the chat function about the role of delegation, and particularly there is our side of, holding our hands up and saying, I can do that, you can delegate that to me. But there's also the flip side of a vet knowing and understanding what they can and cannot delegate or feel comfortable to delegate to us. What do you think in terms of opportunities there for veterinary nurses? How might we better manage that in the practice setting?
Yeah, really good question. So I get very, very sad when I hear of veterinary nurses declining delegation. So, and it happens a lot. And it is a bit of a thing that we never talk about, but you get some vets that will try and delegate something to a nurse and they won't take that delegation. For me, there needs to be, I don't think a flat no is ever a good thing in that situation. I think I don't know how to do that. I would love to learn how to do that. Can you video it for me, show me how to do it, spend the time to teach me how to do it? And then in a practice setting, that then saves time in the future. You're basically sowing that knowledge into the team. So I think that's really important. And I think involving nurses in M&M rounds and clinical discussions is important as well. But I think it's just being it's a hard one. It's an awkward conversation to have, to kind of go up to somebody and say, I tell you what, these are the things I'm really good at, because that's something that I makes my toes curl. It's so kind of awkward, but I think you can go about it in a nice way and say, actually, I can support you with doing this, or this is an area that I'm particularly interested in. I think it is about having those kind of clear conversations, and it is about communication. It's about choosing your time and not kind of making it too awkward, and it should never be about egos. It's about just trying to provide the best clinical provision that we can,
and ensuring we're doing everything in our power as part of the veterinary team to ensure that patient outcomes are as good as they possibly can be, which I think is what we all do try to do, or I certainly hope we do all try to do. There's a comment in the chat, Matt, that I think kind of perfectly summarises exactly what you've just been saying, and that is, why not start the conversation? We do, I think, need to take some ownership to then say to the veterinary surgeons, can we? But you are totally right in that, actually, sometimes you need to pick your moment, and whilst they're elbow deep is perhaps not the time, but utilising the skills that we have available to us in terms of personally, and then in terms of our teams that we work alongside, growing and sharing with each other, I think actually is a way that we can continue to step that forward. Thank you, Matt. Did you have anything else that you wanted to add?
No, I'll just pick up on one thing you've said. I think there is a two-way learning pathway. Veterinary surgeons learn a huge amount from nurses around them, and I think just opening those conversations and discussing them. I think often vets are not delegating things, perhaps because they like to do them themselves, or they're perhaps not as proficient as at that clinical task as they'd like to be, so they want some additional time to do it. But I think those things can be discussed and be factored in. So I think it is about having those conversations, and it is about doing it with the right cultural tone. Lou has mentioned about culture, and I think there is a lot of cultural things there. You should have a nice open clinical discussion and kind of choose your moments as to when you can do things. And I think just getting it normal about, actually, these are all the things that I can do for you as a nurse. I can make your day better because I can take some of the pressure off you, and I can do some of that stuff that will free you up to do the things that I can't do. And I think that's basically the clear point within Schedule 3.
Yeah, that's a really good way of putting it. So there's a couple of comments in the chat that I just wanted actually to clarify, and that is with regard to enhancement of the veterinary nursing role with regard to anaesthesia. And there's also a comment regarding the review and consultation on Schedule 3. Now, I think that what the participants are referring to is the recent work completed by the Legislation Working Party. Have I interpreted that correctly? If you can just comment in the chat, because some of you may or may not be aware that the suggestions that came out of the LWP consultation were fully accepted by our CVS Council, and they are with DEFRA. So again, it is the work, sorry, that the RCVS has been doing off the back of consultations, and actually that was a particularly well responded to consultation, that is ongoing. It hasn't just been forgotten about, but as always, these things do take a little bit of time. So I'm hoping I've interpreted those comments correctly, and if I haven't, forgive me, and please do add another comment into the chat function. Culture is a huge consideration that we could talk for hours about culture, to be honest. But Charlotte, from your perspective, in terms of the varied role that a veterinary nurse might have in practice, there's a comment here regarding those nurses that don't want to do the extras. They want to do their role as a veterinary nurse. And there's a consideration that there perhaps should be a separation between nurses that want to advance and progress and undertake the more complicated Schedule 3 considerations and those that don't. Do you agree with that or not?
I think that as a veterinary nursing profession, I think we need nurses that want to do all types of the job. So you do need those people who it's a job. You know, I mean, for most of us, it's a love, it's a passion, whatever. But, you know, we do need those people that go in every day and then they go home and they do something completely different. Or, you know, they've got another job. You know, we need those kind of people. But equally as well, we need the people who do want to do more Schedule 3 tasks, who do want to advance their career in different ways. And we can all support each other in that, I think, because, you know, in talking about culture and, you know, and I said at the beginning of my bit, you know, that, you know, we do have to work as a team together to champion each other, you know, like, and somebody put in the chat about the fact, you know, that pay is often linked to management roles. I'm not a manager, you know, I'm just not that person. I'm not cut out for that. But we need people who are. But, you know, equally as well, we need people who can manage, who can lead teams, you know, that can be like clinical directors of practices, you know, that. So, yeah, I guess we need all types of nurses. So, yeah, I would agree with it, I suppose.
Yeah, and I think ultimately the right person doing the right job at the right time.
Absolutely.
Yeah. Okay, fab. So moving on to some further comments that we have had in the chat section. There's been a few people that have started almost alluding something that I wanted to bring in anyway. And I'm not sure if this is perhaps where this conversation was going to go, but we're here now. With regard to structural framework for RVNs, as opposed to, we have the standards framework for veterinary nurse education training for our students. We have a very robust training process that they have to go through. And then upon registration, you have to do your 15 hours of CPD each year, which you have to reflect upon. But there's no further kind of, other than our code of professional conduct, there's no further guidance or framework with regard to what's expected of you in terms of development progression as a veterinary nurse. Is that something as a panel you think might be something that could or should be considered in the future? Might it help us to take a step towards the advanced practitioner role? It's certainly something, and Belinda, I'm sure you're aware of this already, it is something that human nurses have. Is it worth considering that, or do we think that is unnecessary bureaucracy? I'm going to...
first to this.
Freely answer.
I think we are so much more diverse than the human build. It would be very different. You know, NHS is a massive organisation, one company. We have thousands and thousands of companies, which are all very, very different. So I think our training is very, very robust, and it delivers the, you know, day one skills that we need. And I don't think necessarily it needs a structure straight away afterwards. I think the CPD is well planned, and I think it should be suited to the role that you're doing. So if you're doing, for instance, 20% anesthesia, you know, I believe that you should be doing, you know, kind of 20% CPD in anesthesia, for instance. So then it stops it being on a certain subject that you might like, but maybe not necessarily your job role. But yeah, I'm not convinced that we definitely need a clear structure of exactly training, because we are so different and unique.
Thank you. Charlotte, Matt, any differing opinions, agreement?
I just think that I always say to new nurses when they qualify, the students that I've had, on the day they qualify, I always say the next year is going to be challenging. I think the analogy I always use is just like learning to drive. You learn to drive, and then the first time you go out by yourself and there's no one sitting left to you, it's actually quite scary. And when somebody tries to asks a question, and when you've gone from your stripy to your greens, and you kind of look behind you thinking actually they can't be asking me, and they are asking you, that's quite a lot of pressure. And I think this does come back to culture and all of the RVNs around those people being incredibly supportive to them, and also being honest with them. I always tell my nurses I was absolutely useless when I first qualified. I was nervous. I was.
I said, no one believes that.
Some would say I still am now. So I think it just takes time to grow into it. It takes time to be that lead person and that person giving direction. Veterinary nurses, students or RVNs, whatever they are, some of them are mentors and kind of ambassadors without even realizing it. When they're students, if they're that person that kind of is upbeat and kind of positive and brings that nice culture to the practice, that's really, really good. But we need to be honest with each other and just support each other when we're newly qualified, and just say, actually, it is quite hard. That transition is not kind of straightforward for everybody, and it does depend on the type of practice you work in. I was like, we're all talking about our histories, it's like this is your life, but when I first qualified, I was very lucky. I worked in a really nice practice, was very well supported, lots of RVNs, and actually they were all really honest with me and were just like, oh, actually I'm really good at this, but I'm not very good at this, and that's what we need. We need to create that culture that when we're qualified as nurses, we are RVNs and we are very much a force to be reckoned with clinically. We do amazing work, but we need to build our skill set after that point. We need to kind of find our groove and find our kind of niche, and that could be in different areas. Whatever you do as a veterinary nurse, your qualification will be incredibly useful for you, but it is important that we just accept that that area of support is needed, and it should be provided by us all. Everybody has gone through that process, and everybody has had to train at some point or another. I would just say, without going on for too long, I think we need to really, really avoid saying, oh, it's so much easier now than it was when I qualified. I have to say it was much easier when I qualified, because we learned practically nothing. So, you know, this is a cat, this is a dog, right, off you go. It was the level of knowledge and experience in students now is amazing. I had a tutorial with my student today, and she's incredibly knowledgeable already. She's getting a really good clinical background. She's learning all the kind of essential things that we never got taught. So I think we just need to avoid not trying to compare our own journeys with other people that are in the more robust training system that we see now. But I think just supporting them as individuals, and also being honest that actually you didn't put your greens on and then never have any kind of imposter syndrome thoughts, I think is really powerful.
Yeah. And from the perspective of my day job, Matt, I'm very reassured to hear about your student and her robust training. Charlotte, any further considerations from you on this topic before we move on?
So I think like your original question about, you know, sort of moving towards having something like an advanced practitioner status or something like that, I think, you know, and about CPD and having sort of more sort of forced CPD, I think, you know, I think it's as Belinda said, I think
just to clarify, and I think this comment did come up in the chat, as opposed to considering kind of enforced CPD, as it were, I more meant almost like regulatory checkpoints through the role and lifespan, if you like, of a veterinary nurse. So in human nursing, they have annual kind of requirements to meet, and it's things like demonstrating that they've worked in an interprofessional way, for example, demonstrating that they've contributed to research considerations, things like that. So it's not necessarily you must sit down and do 2 hours a week of this, that, and the other. It's more to progress the veterinary nurse, no, the human nurse, sorry, kind of mindset, skills, knowledge, understanding, that side of things. And it's a question really as to how could we potentially reflect something like that? Would we want to? Would it be beneficial? Or, as I said to start with, is it unnecessary bureaucracy?
It is, I think it's a big area, to be quite honest. And, you know, I think, and I was involved in some kind of discussion, just like giving feedback about how people would feel about, so say, for example, like retesting RVNs, like almost like they do with the VTS thing, where you have to recredit every 5 years, you know, and whether or not that's a good thing. I mean, to use Matt's driving analogy, you know, you don't have to retake your test, I don't think, until you're 70 or something like that. So, you know, what we have there, I don't know if that's sufficient. It certainly is for those people who do apply it, who do the 15 hours, you know. Some people will do that a day, I'm quite sure, you know, rather than a whole year. So I think, you know, I think we do need to grow. We do need to develop professionally. You know, again, as Matt said, you know, it is day one, really, when you go into solid greens. And, you know, there's the two parts to it, isn't there? Because there's the bureaucracy and the regulation that goes with it, but then there's the sort of counter argument as to, well, why wouldn't everybody want to improve their patient care? You know, and as Belinda said, you know, about 20% anaesthesia and then 80% something that you do, but it's not your niche. You know, again, that's a good idea. How, of course, you could enforce that, again, is another problem or another headache anyway. So yeah, I think it's a very interesting issue. I think it really is. But I think in some ways, you know, why can't we try to inspire nurses to be the best that they can? So having something like an advanced nursing practitioner role, you know, that just encourages nurses to be, because there will be some nurses who think, oh, I could do that. You know, I remember during my study, we had a lecturer from the RVC, and she was talking about blood transfusions and central venous pressure. And I said to myself at that time, I want to go and work there. So, you know, it does inspire people if you have sort of, you know, the sky's the limit, I suppose.
Fab, thank you.
Quick fire question. Can I just jump in with something just very quickly, just picking up on something that Charlotte said? I think we are professionals now, and we should be honest with our CPD. So I can go and sit in exotics lectures, and it's very comfortable. It's like a kind of comfortable pair of slippers, and I can sit and I can see my friends talking, and it's all really nice, and learn absolutely nothing. So I really do push myself out my comfort zone. I go to ECC ones, I go to cardiology ones, because I think any of those things you go to, you will come away with some little nugget that will make you better in your role as a veterinary nurse. So I think as professionals, we need to just be a little bit honest with ourselves and not just go and see our mates. You know, that's lovely and it's really nice, but actually, do you actually learn anything? So I think take yourself out of your comfort zone, and you never know what you'll find. You might find somebody you think, actually, that's really good. I can take that back to practice. So I think there is a need for us to just be really professional in that respect.
Yeah. Interestingly, and by sheer coincidence, two of the delegates have fully echoed and mirrored actually exactly your comments in the chat. So CPD is a true checkpoint experience if it's used appropriately. But CPD is not us just doing the same thing all the time, and it should be our opportunity to learn and grow. if you aren't actually using it to develop yourself, then it's not CPD, because obviously it's continuum professional development. And if you're not developing, you're therefore not doing CPD. And actually, for those of you that put that in the chat, and Matt, excellent points. And if we take nothing else away from this evening's discussion, perhaps we will all consider exactly what it is that we're logging as CPD. So very briefly, quick fire question, because this has come up a lot in the chat. And I think this is something that is absolutely being looked at and considered, but just very quickly, brief thoughts, Charlotte, Belinda and Matt, on the role of the advanced practitioner, something that we need, something that we don't need, something that you see as feasible and doable or not. Charlotte, let's start with you. You're first on my screen.
Okay, thanks. So is it doable? That would be for the RCVS people to answer, I think, more than me.
That's why I'm asking you, Charlotte, so that you can help me write the case for it.
But I would say yes, why not? Personally, because like I said, I think it's something to aspire to.
Great, thank you. Belinda?
I would say 100% yes, and I would say from advanced practitioner, but also nurse prescriber, which are in the human field two separate things.
Yeah,
you get one and then you get the other one. And I think why not? You know, it should be, and it should be in areas. So there should be a generalist one. So it shouldn't just be in specialists of different areas. I think we need to have a general, you know, small animal one, and normal one for general practice of being advanced in that role, not just in, you know, specialists other areas. I think it's really important, and I think it needs to happen, and I would very much encourage it.
Lovely, thank you. Matt?
Yeah, and I think it needs to happen. I think nurses in practice are pretty much already doing most of this stuff. I think it would just be really enhancing it and making it more robust and also quantifiable. Lots of people in the chat box have been talking about whether there is a correlation between additional knowledge, understanding, qualifications, etc., and salary. And I think that will come. I think it's about all conversations again and about kind of chatting about those things. I would say with great power comes great responsibility. So I think those people that if we are able to create this role, which as I say, I'm confident will happen, we just need to make sure that those people are mentors, ambassadors, and then really kind of highlight those roles. And I agree, those people don't need to be in referral centres. They can be your person Absolutely. That is a kind of cornerstone of your clinical team in practice. And I think it is just about making sure that we look at what we already have. There's some brilliant consulting nurses already out there, and some nurses that really provide that holistic support to clients as well. So I think yes, it's a definite yes. But yeah, I think it just will take time because it needs to be absolutely on point.
Thank you, Matt. That's really helpful, and also reassuring from my perspective, because certainly from the internal workings of the RCVS, that is absolutely the direction that we expect to be heading in, and we do hope that advanced practitioner is on the horizon in the not too distant future. So we'll be coming back to you all for further discussions. There's just one final comment that I wanted to address in the chat very briefly, before we kind of come to closing remarks, and that's with regard to the VTS. And I'm just to clarify quickly, the VTS is not recognised in the sense of the word by the RCVS because it's a status, not a qualification. So that will then be employer dependent. With regard to the RCVS accredited qualifications, there's obviously the suite of Cert AVNs available, and there are now 23 accredited qualifications, which is incredible considering we had 2 DIP AVN providers 4 years ago. So we've now got 5 Cert AVN providers offering 23 different courses, which is incredible. So I think, to reference Belinda's and Charlotte's comments, are stepping stones. Those of you that are looking to advance and progress, the Cert AVN might be that first stepping stone post-qualification. Utilising your CPD and actually using it to develop you and not just sit with your friends in the comfy lecture theatre, as Matt was saying. So couple of key points that have come out of this evening's discussion. We can't get away from the pay discussion. That has been, you know, we started off with pay, and I feel like we've kind of ended at pay. And to reiterate Matt's comments, the RCVS cannot, to be honest, even advise on pay, because employment law is something that as the regulator we have no involvement in, with regard to your salary and your contractual discussions. So having those awkward discussions, and actually from the conversation that we've had tonight, that empowerment of who we are as veterinary nurses, the skills, the capabilities that we bring to practice, actually take that into those conversations where people are then able to say, I feel that I am worth more because of this is what I bring to the practice. And actually one of the comments in the chat had brought a really interesting perspective with regard to the advanced nurse practitioner. It's creating income stream, and therefore that can back up your request for a higher salary. And that is the mindset to be having. It isn't just about I want more money because I want more money. It's I want more money because this is what I bring to the practice, and this is how I can improve patient care, patient outcomes, revenue stream, clients through the door, better communication, all of those things. And making sure that it's not just looking like you think you deserve more, but being able to justify why you deserve more. And that's quite a key difference, I think. We have obviously discussed legislative change and reform at length, and protecting the title does go hand in hand with that, Charlotte. So to revisit some of the comments that you were making earlier, there's that consideration that all ties in with the LWP consultation. And I think that one of the RCVS team has shared the consultation responses within the chat function. When we are before we finish this evening, I will just ask the RCVS team just to re-add those links, because there's been such an ongoing thread of chat in the chat box that they might have just got lost higher up in the chat. So if we just reshare these links, that would be great. In terms of empowerment and who we are as veterinary nurses, this concept of teamwork and the veterinary team, vet-led team, and whatever that might look like in the future, but that consideration of standing up and shouting about who we are, so contributing to the campaigns that come out, the consultations that come out, and sharing it on your social media, so that it's not just the veterinary nursing world or the veterinary world that is aware of it, but it's the public, it's your parents, it's your friends, it's your siblings, it's your partners, your children, their friends at school. Everybody knows and understands what it is that we're trying to do in the veterinary nursing profession, and we can't do that without that feedback from the professions and then stakeholders in a wider sense, i.e. the public and pet owners. Ultimately, I think championing ourselves, having those different conversations, and Matt, that's an expression that I've borrowed from you, but I'm going to absolutely be using that in the future. Back ourselves. We are qualified, registered professionals who have ongoing recognition requirements in terms of our CPD, and we have every right to be able to stand up for ourselves and say, this is who we are, this is what we can bring, this is what you can ask me to do, and this is what I'm prepared to ask for my further development on. So again, final comment from Matt, just to reiterate that conversation about that two-way learning pathway. We can learn from vets as much as vets can learn from us, and the wider paraprofessional team as well. You know, I'm a small animal nurse, so even when I'm doing my CPD and equine practice, although I'm working with other RVNs, I'm still learning from them about their massive catheters that they put in, and they're still learning from me about restraint techniques, for example, because it's a very different kettle of fish for those of you that have never spent any time in equine practice. We should all be able to learn and develop each other, vets, nurses, paraprofessionals, the reception team, the admin team, the cleaning team. We ultimately all work together so that we can ensure best patient outcomes, and that ultimately is what we should be striving for. We aren't going to fix the problems of the workforce crisis where we are right now, in terms of pay, recognition, all of those things. But we also do know that those are the areas to focus on and work on. So a couple of things that we, in terms of our CVS workforce, are working towards right now. The Academy course. Those of you that haven't visited the Academy course yet, I would strongly recommend that you do so. We have some really great VN specific courses up already, but some wider courses regarding leadership versus management, the skills of delegation. And we also have some new courses that we will be launching this year about further support and development for veterinary nurses specifically. So that's always worth keeping an eye on. We also have the leadership library. So again, those of you that are in leadership or looking to move into a leadership role, that is a brilliant place for you to start. And I cannot talk highly enough of the work that the Knowledge does, particularly with regard to the QI developments. I said almost an hour ago now, you know, we want to be an evidence-based profession, and that area of veterinary nursing empowerment and development, it is something that we can really take a hand on in practice, and looking to improve those patient outcomes through quality improvement, clinical audit, improved governance, that side of things. So again, if that's an area that you are interested in and that you want that to become your niche, that's a really good starting place. The RCVS team have helpfully reshared some links for you. So there's also the superb delegation poster, which is a good starting point in regards to effective delegation. And Sophie's also just shared the link to the Knowledge homepage as well with regard to quality improvement. So some key points there that you can take with you. Hopefully you now feel inspired and empowered to be able to go away and think about where we are as a profession, what you can do in your own small way, and then contribute in a wider way with regard to campaigns, consultations, getting involved with working parties, standing for council, for example, and ultimately helping us, as in the RCVS, but us also the profession, continue to move things forward, so that we can take our 62 years old, our 62-year-old profession, and continue to make it something that is learning and growing and developing. That is everything from us this evening. I will just ask the panel members quickly to add their contact email addresses, if they're happy to, into the chat box, so that if you have specific questions, I know there were one or two that were directed at specific panel members, they can add those sections, they can add their email addresses in there if they want to, so that you can come to them directly. Otherwise, if you have an RCVS question, I will add my own email address as well, and you can come to me if you have vet nursing RCVS specific questions. I'll do my best to answer. Otherwise, obviously, I'll be utilising the knowledge of my fearless leader, Julie Dugmore, Director of Veterinary Nursing, who couldn't be here tonight but was very sad to miss it. And where there's very meaty conversations, we have 2 members of council with us this evening, and horizon scanning is a big part of what council is doing and does do, and we can make sure that that is taken back to that as well.
Thank you, Shirley. That brings us to the end of the session. So thank you to the panel for all your support for tonight. We will be providing a summary via email, along with the recording link and a feedback survey. That will be with you this week. We hope you've enjoyed the session, and look forward to you joining future sessions in the next month. Thank you, take care, and have a lovely evening.
Bye, everyone.